Welcome to SoCal Tech Interviews, where we talk with the entrepreneurs, investors, and others in Southern California's high-tech industry. Our interview today is with Courtney Farr, the CEO and founder of House Calls Mobile. I'm Ben Kuo, founder and editor of SoCalTech.com.
My name is Courtney Farr. I'm the founder and CEO of House Calls Mobile, which is the virtual provider's visit. And I invented a virtual stethoscope to go with it, which is like a regular stethoscope, except you plug it into your phone like you would your earphones.
And what is a virtual house call?
Well, nowadays, a lot of people are wasting time at the doctor's office. They are spending half the day waiting for their doctor to give them a diagnosis they already knew they had. So virtual house calls are basically where you can do a video conference with a medical provider through your phone, through live video chat.
And what's your background and how did you get into this?
I'm a nurse practitioner. I've been a family nurse practitioner for 18 years. I put myself through USC for undergrad and Yale University for my graduate degree. And I work at the VA full-time, actually, as a nurse practitioner currently. This is my second job.
Yeah. Why did you decide to start a company?
I felt like there was only so many patients I could see hand-to-hand a day. When I worked at the community health center before my VA job, 20 maybe patients a day would be max. Whereas with virtual visits, every 15 minutes you can see a patient and you can get them their care. My mother had breast cancer when I was a little girl, and I feel like if we had better access to care when I was growing up, she may still be with us today.
A lot of people with a remote access, they say, can you do the same things as you could in person? How does that work?
Yeah, so in school they taught us that about 90% of a diagnosis is by interview. Your doctor only gets about 10% more information through physical exam. So you might notice with your own doctor's visit, your doctor pretty much has already written the prescription before he's even laid a stethoscope on you. It's the same thing. Most of the diagnosis can be made through the video conferencing. The doctor can pretty much get a main idea of what your problem is and already have come up with pretty much a diagnosis. That last 10%, that physical exam, is what they can kind of just make their decision with.
So how far along is your startup?
I have a working prototype, and we are going through FDA approval right now and getting clinical trial this fall for the FDA approval. So we're getting some seed round investment money right now. We're trying to work on a lean startup model.
So how much approvals are needed by the FDA for something like you provide?
Yeah, so fortunately our device, as you may have noticed, there are plenty of stethoscopes out there. They've been around for a long time. So our device actually has a class 2 device, which is great. It's very simple, and we can qualify for what's called a 510K, which in the FDA world is basically there are things out there that already like it, and you have to just compare your device to a regular stethoscope and otoscope, because there's a combined device, and make sure that it's medically safe and not going to harm anybody, but we already have plenty of those out there, so it's a fairly fast-track process.
And what's the next step for your company?
I want to start seeing it in the hands of my patients. I want to be able to see it, I work at the VA. I'd love to see it with virtual providers visits throughout the world. I could see it being dropped by the boxes into disaster relief areas so that you could have virtual visits in disaster areas. I could see it in EMT bags where the ER doctor can do a virtual visit through the ER so that patients don't always have to come to the hospital. I really see a big clinical use for this, and it just needs to get out there, and so we're trying to get it out there.
What has been the biggest lesson you've learned as an entrepreneur so far?
constantly learning. Constantly learning. This is the hat of many different people. An entrepreneur, you are everything. You answer the phones, you make the decisions, you gotta listen. You have to listen to people, try to get some advice as you go along, because it's kind of a learn as you do kind of process.